Hi, I am Hyung of Korea, working at the Suncheon University, Bucheon Hospital. I am reconstructive surgeon majoring in lower extremity reconstruction and lymphedema. I am really pleased to publish my case report about treating the upper extremity lymphedema occurred after COVID-19 vaccination. Actually, the COVID-19 outbreak is almost subsided to endemic disease, but still, adverse effects and bad sequelae after COVID vaccination is an ongoing issue. In that aspect, this report supports its value. Actually, this is not the first report about the lymphedema after COVID vaccination. There are several reports about lower extremity lymphedema and upper extremity lymphedema after COVID vaccinations. Besides, there is report about outbreak of upper extremity lymphedema in breast cancer patients after COVID vaccination and frequent cellulitic events in pre-existing lymphedema after vaccinations. So, even if its incidence is relatively rare, the vaccination-induced lymphedema certainly exists and its treatment option is not reported before. So let's see the report. 80-year-old female patient presented to the clinic, and there were no previous history of surgery at trunk nor the upper extremity. But the only history was the vaccination for COVID-19 18 months ago. There was secondary vaccination with Pfizer-BioNTech 16-2B2. It was the mRNA vaccination, and the edema occurred to the same arm where the vaccination was done. The patient got admission from the Ministry of the Health and Welfare of Korea about the relationship between edema and vaccination as an adverse effect. To find the cause of the lymphedema, CT was taken and there was no evidence of malignancy or abnormality at the axilla was found. At the lymphocytic scan, there was diffuse dermal backflow at the distal forearm level and ipsilateral axillary node was not seen. If you see this table, there was 6 to 15 centimeter difference of the circumference between two arms. And back to the figure 1. Before planning the operation, the patient took compression treatment and manual lymphatic drainage for 1 year. As you see in this picture, there was a compression marking at the arm. But there was no significant change after the compression, so we planned the operation. As there was no history at the axilla, lymphovenous shunt and small amount of liposuction was planned. Intraoperatively, 0.4 and 6 lymphatic vessel was found, and side-to-end lymphovenous shunt for each of them were successfully done. Then, 850 cc of liposuction was done, and the compression treatment was continued post-operatively. After 3 months, the volume of the affected limb reduced almost 900 cubic centimeter, and at 8 months post-operatively, 1000 cubic centimeter of volume was reduced. This is the findings of 8 months post-op. We can see significantly reduced circumference and even the wrinkle at the hand dorsum could be seen. Vaccine-induced lymphadenopathy was suggested as a possible cause of lymphedema after vaccinations. There are some literature reporting that lymphadenopathy after vaccination can worsen the lymphatic drainage. Moreover, mRNA vaccination for COVID-19 is maybe linked to an inflammatory response to rehydronate, for which the lymphatic is the main drainage system. So this report has the value of report for successful treatment option for vaccine-induced lymphedema. Thank you for watching.